My name is Dr. Mojisola Odeku. In this video, I shall be giving you an overview of proper clinical service provision. It is important to follow correct procedures for quality family planning clinical service provision. Clinical examination is the foundation of quality service provision. The main objective of conducting clinical examination is to help you establish a complete and comprehensive understanding of client health history. It also helps you identify any health conditions that may contraindicate a specific contraceptive method. Finally, clinical examinations help you discover any abnormalities that may require treatment, such as pre-existing conditions like hypertension, anemia, sexually transmitted infections, or other health issues that might require further tests or consultations. So now that you understand the importance of clinical examination, it is important to refresh on the various steps a provider should remember to follow in order to ensure quality and comprehensive examination of clients. Step 1 is creating a conducive environment. To conduct a proper family planning clinical examination, you need functional equipment and tests, secure space for clients' comfort and privacy, and continued communication and interaction with clients to explain the processes you are carrying out. Step 2 is to follow the gather approach, taking time to assess your client's health status. You need to be able to ask clients for detailed history, which will include information on contraceptive history and health conditions that may contraindicate the use of specific family planning methods. Step 3 is to conduct a comprehensive clinical examination. A comprehensive clinical examination involves 3 main parts: a general examination, a physical examination, and laboratory testing. Here, you need to look by examining client for abnormalities, gynecological conditions, and sexually transmitted infections, and manage by treating them appropriately. The general examination starts by taking the client's blood pressure and weight. Next is the physical examination, which includes abdominal, breast, and pelvic examinations. The pelvic examination includes the bimanual palpation and the speculum examination. Then, you have the laboratory testing, where you will conduct the necessary tests, such as the pap smear, urine test for pregnancy, and so on. Finally, you need to refer clients for further treatment where necessary. Step 4 in quality family planning clinical service provision is family planning specific method counseling. It is important to offer comprehensive method selection and client-centered counseling. To do this, you must have the available tools for assessing criteria for selection. In other words, the WHO MEC wheel. You should refer to the counseling section of these distant education videos to refresh yourself on client-centered family planning, decision-making, and avoid biases. You also need to be sure to refresh your knowledge on different family planning methods, the pros and cons, and side effects, and so on. This is so that you will be able to provide thorough and balanced information to your clients. Finally, It is important to provide take-home materials or handouts when available if the client would like to know more about a specific method. Step 5 in quality service provision is method administration. Once the client has selected a method and consented to the procedure, you need to administer the chosen method. Hopefully, you will have their method of choice in stock because you are already practicing proper contraceptive logistics management systems. You can refer to the modules on CLMS for more information. Continued practice of insertion and removal of family planning methods will ensure that you are comfortable. Please review step-by-step videos available in the Distance Education Library of common methods to refresh yourself on insertion and removal of IUD and implant or discontinuation of injectables and oral pills. You can also find more information about good hygiene protocols and infection prevention information in the Distance Education Library. Don't forget, you need to be sure to provide the client with clear instructions and information on their chosen method, and give the client information leaflets to take home if they are available. Step 6. The final step to providing quality clinical service provision is follow-up. It is necessary to remind clients about the need for follow-up and to encourage them to come back should they experience any side effects of complications. Schedule a follow-up appointment for the client if necessary. And don't forget to make sure to fill out all the data from the visits in the family planning register. You can refer to the CLMS module to learn more about doing this. One of the main barriers to quality family planning clinical services is time. The reality is that many providers face challenges of too many clients, not enough staff, and limited resources. Often, it may seem that there is not enough time to fulfill all your tasks whilst maintaining a high standard of service. Despite this challenge, it is important to find the time to conduct a comprehensive clinical examination and thus provide quality services to all clients. There are certain skills you can develop to help you improve organization and manage your time more efficiently. There are several benefits of quality clinical service provision. For instance, clients talk, and if they have a good experience, they will encourage others to go for service, or the opposite if they have a bad experience. Quality service provision will also improve client satisfaction in you and your facility, making them more likely to use family planning and return for follow-up. Finally, your provision of quality services will give both you and your clinic a reputation for excellence and result in healthy women, healthy children, and a healthy community around your area.